Good afternoon and welcome everyone to our monthly webinar that we do. And this is health products for you. And today we're bringing you a presentation on tips for a healthy respiratory winter. Every month we try to bring you some sort of format that has respiratory involved. And if you have any comments or would like to see something in particular for us to do, please let us know in the future so we can cover that topic. But as for today, we're going to cover some tips for a healthy winter. So let's talk about your home first. So in your home, as we all know, we have heating systems, and unfortunately our heating systems create a lot of dust in the house. So if you're using oil or forced hot air, some of the things that you should do is try to mitigate the dust if you can. Now, how to do that? Vacuum as often as possible if you're able. Sometimes it's best if you can open windows during nice days. Also, look for sources of mold. Mold is a very, very huge irritant for a lot of our people that have respiratory illness. And even if you don't, molds can be in places that you don't realize. Overwatered plants. A lot of times the soil will get saturated and it'll start to grow some molds, and those mold spores can become active in the air, and then you breathe them in and they're an irritant to the airway. Also, sources of mold, as we all know, anything that leaks, your bathroom, shower, if it's dripping, you can get extra mold on the ceiling and the walls in there. And if you have any leaks in your roof, those things should be attended to if you're able. Keeping sources, this is a tough one because a lot of people love their fireplace or their wood burning stove, but if you suffer from any respiratory illness or if you're very sensitive to smokes, then you might want to not do those or not be present in the home when a fireplace is burning, a wood burning stove, or a coal burning stove. Anything that's gas fired does not put out particulate matter. So if it's a propane or a gas stove, you should be fine. But for anything that produces smoke, even though you may not be able to see it in the house, it's present and it could be a very big irritant for the airway. Make sure your home has adequate ventilation. And on warmer days like today in Connecticut, it's 64 degrees, a great day to open the window and air out the house a little bit and let some of that dust and things get out of the house and some fresh air get in. And always consider purchasing any kind of environmental remediation, such as a humidifier, a dehumidifier, or an air filter or purifier or cleaner. That always helps in the home to keep the home free of dust and pollens and any type of irritants that might be in the air. So the next slide we're going to talk about is how to mitigate illness in the winter. And this is a big one. And I did home care for many, many years. And the first thing we would tell any of our patients who suffered from lung disease or any kind of health issue that had to do with their lungs was stay away from the kids. Unfortunately, most of our patients had grandchildren or their own children, but as we all know, kids this time of year are big carriers of virus and any kind of upper respiratory diseases. They can have bronchitis or a cold and not get as sick as some of people that suffer from lung disease. So if you have children around you want to be around children, make sure that they cover their mouths when they cough, they wash their hands frequently, and if they're sick, try to avoid being around them. Keep your get-togethers small. We've been talking about this for a couple of years because of the pandemic, but even aside from the pandemic, and we won't even talk about that, the smaller crowd that you're involved with, obviously, the less likely you are to be contaminated by somebody else's germs. So if you have a high chance of catching something because you're immunocompromised or that's your MO, you catch things very easily, then you might want to keep your gathering small or stay out of big groups of people. Obviously, this is a very big one. No matter what time of year it is, make sure you wash your hands with soap and water often. We tell patients to wash their hands with soap and water and sing happy birthday while they do it, because that tells you that you've washed them long enough before it's time to rinse. A lot of people just like to soap up quickly and rinse, and then you're not getting enough friction so that we can get rid of the bacteria or germs that are on your hands. Or you can use hand sanitizer, which are mostly alcohol, but some people can't tolerate that on their hands. It burns. So soap and water or something to keep the hands clean. So that way, if you're touching the mucous membranes on your face, you don't put any bacteria or germs in there. Obviously, this time of year is big for flu. We still have COVID-19 around. So when they're telling you the incidence is high in your area for flu, Try to stay out of public places. Be really good about your hand hygiene. And if you're compelled to, wear a mask. If you're immunocompromised, it's probably your best defense to keep the germs that are in the air away from you. It's very important that you eat properly and get some exercise outdoors. Now, some of our patients who suffer from COPD or severe lung disease, they'll have to get permission from the doctor to go out in the cold air and do any kind of exercise program. But I'm talking about our general public. It's not a bad idea to get outside and get some fresh air. I don't say start embarking on an exercise program you've never done before in the cold, but just to do normal exercising, just to get some fresh air, open up the lungs. And eating properly is very important because there's a lot of nutrients and vitamins that we need that are different in the winter than we need in the summer. I'm a sleep specialist, so I know that maintaining a sleep schedule is very important. If you are an early riser and you do that all the time, that's great. If you're not, that's great too. But as long as you keep yourself in a proper sleep function, that you're getting enough, hopefully at least 8 hours a night or as much as you possibly can. Also, some people suffer from seasonal affect disorder. They call it SAD. And there's light therapy for that. The lights have a certain spectrum of light that mimics sunlight. So that way you don't suffer from depression and things that SAD brings along. Staying hydrated is very important. Make sure, even though it's not summer and we're not dealing with extreme heat, you still need to stay hydrated. The house is very dry in the winter because your heat is running. And if you have a lot of secretions, they can get dried out. It'll be hard to mobilize them without enough fluids. And I'll always continue to take your medications as prescribed by your provider, even if you're not symptomatic. A lot of times medications are actually prophylactic. They're supposed to keep you from being symptomatic, and that's why you're not symptomatic. But if you stop taking them, the symptoms will return, and it might not be a good idea to do that. So diet options. In the winter, we like comfort foods, and that's good because they fill your belly up, and a lot of them are filled with fiber, especially oatmeal. You want to keep your bowels moving. That's a big thing. We don't exercise as much in the winter as we do in the summer, and a lot of times exercise helps keep your integratory system going. Any foods that are rich in vitamin C, we miss out on a lot of sunshine in the winter because we're stuck indoors. So our vitamin C is our sunshine vitamin. So if you can get some extra vitamin C, either through nutrients like fruits and vegetables, or a supplement if you have to. I also recently had surgery, and one of the medications that they give you is vitamin C to help you heal. So we know that it's great for your immune system and it's great for healing. Also, foods that are high in zinc help our immune system. Those are your legumes and your spinach and things like that. Obviously, fish, eggs, and cheese, and are high in B12. We need that to help reduce fatigue and help our immune systems. Everybody's known for years and years how great garlic and ginger and their healing properties, and they're great supplements, ginger teas and things like that. And in the Northeast here where I live, there's a high incidence of MS. And we know, or at least there's studies going on saying it's because we get such limited sunshine up here, we're missing a lot of vitamin D. And they think that's a correlation between MS and the vitamin D deficiency. So make sure you take some vitamin D supplements and check with your physician before you do that, because sometimes you need to take calcium with it. It depends. So these are really good diet tips. Now, as far as the next slide is our viruses versus our bacteria. A lot of times people are confused and they think they're one and the same, and they're not. Viruses cannot be treated with antibacterial. So you can't, if somebody has a viral infection, which will be determined by, swabbing, or the doctor does a culture, it cannot be treated with penicillin or any kind of antibacterial, because it's not going to kill it. It's not a bacterium, it's a virus. Bacteria, believe it or not, is not always bad. We have bacteria that's good for our body, that lives in our stomach and in our intestines and stuff. And those are the good bacteria. But virus is always bad. When you hear the word virus, it always means it equals sickness. Antivirals, a lot of people are very confused about antivirals. They're not like our antibiotics, where antibiotics, you'll start to turn that corner pretty quickly. Antivirals don't always get rid of or cure the virus. They just stop the reproduction of the virus, or slow it down. So it may take a little longer to get rid of a virus than it does to get rid of a bacterial infection. So examples of virus are flu and COVID-19, and examples of a bacterial infection would be maybe strep throat or pneumonia. In some respiratory illnesses, that's the consequences of not treating the respiratory illness, whether it's bacterial or viral, that as time goes on, it can turn into a bacterial pneumonia as a consequence, where you'll need some antibacterial medication, either penicillin or whatever they decide is appropriate for that particular pneumonia. Now, going outside, we want you to go outside in the winter, but we want you to be very careful. People that are sensitive to cold air, you should cover your mouth and your nose with a scarf, because it does chill the airway and cause bronchospasms sometimes. I know a lot of people that have asthma that cough a lot if they breathe in cold air. So it's not a bad idea to cover your mouth with your mouth and nose with a scarf. Do anything exertional within your own limits. Like I said, now is not the time to embark on a full-blown exercise program that you've never done before. Take your phone with you in case something happens and you fall or you injure yourself or you need someone in an emergency. At least you have an access to get to somebody. I take my phone everywhere I go, and just in case I would ever fall outside, at least I can call someone to help me. Be aware of your footing. You know, we're going into winter, and we know that we get ice and snow up here in the Northeast. So you have to be careful when you go out, you don't fall. One of the biggest problems in the winter is slips and falls, and they can cause secondary problems. You could break a bone, you know, you can injure your head. So be very careful. If it's very icy and snowy and you're not good in that terrain, don't go out. Excuse me. Dress appropriately. A lot of people skip the hat and the gloves, but you'd be surprised how much heat loss is done through the head. So wearing your hat is important, and using gloves to protect your fingers and heavy socks to protect your toes. Last thing you want to do is get frostbite and have to go to the emergency room or have anything be amputated due to that. Stay dry. That's very important. If for any reason you get wet, you're outside and you get wet somehow, try to get back to your car or back home so you can get warmed up. The worst thing is to be chilled to the bone like that. It's very, very hard to get warmed back up. We want you to enjoy your winter. Winter is a great season, even if you don't like snow and the cold. The air is nice and clean and fresh, but we want you to be safe during that time too and not get sick. I thank you for attending the webinar today. Do we have any questions that I may be able to answer for anyone? No? Well, we look forward to seeing you next month with another topic. My email is laura@hpfy.com. And if you have any questions, or if you'd like to hear us to cover a certain topic respiratory wise, we'd be more than happy to do that. Well, thank you for attending today. You can find our this webinar on our YouTube channel. Stay healthy and enjoy your winter. And if you celebrate the holidays, enjoy the holidays. Thanks for being here.